Friends, good day. I am Dr. Ramesh Parmi, surgical oncologist with the PACE Hospitals, Madhapur, Hyderabad. Being an oncologist, having seen hundreds and thousands of cases of cancer from various organs, my own assessment is that oral cancers, otherwise called mouth cancers, is the commonest I ever come across in the head and neck cancers, especially in our country. It is said that in the last census, as per the Tata Memorial Hospital Mumbai assessment and epidemiological survey, 65,000 new cases were diagnosed in 1 year throughout the country of very fulminant oral cancers. The oral cavity, as you all know, includes lips, then the cheek, tongue, floor of the mouth, that is under the tongue, the hard palate. So these are the various parts that constitute part of the oral cavity. And oral cavity cancer stands at place 6th in the overall cancers globally. So it's not a problem mostly in India, and it's a global problem worldwide. So it stands at the place 6 in the tabulation of the cancers globally. In India, in men, this is the second commonest, next only to lung cancer. In women, actually, it used to be the second place, now it is in the third place. Carcinoma of the breast, cancer of the breast, and cancer of the ovary, endometrium, uterus has taken the second place, including lung. Third comes the oral cavity. The reason, as we call epidemiology, is that there are some factors which cause oral cancers. Commonest in the oral cavity is the cancer of the cheek. This is caused by not only external agents but also some intrinsic or internal factors. Let us go into details of origin of the oral cavity cancers, especially of the cheek cancer. As you might all be aware, tobacco is blamed, especially the smokeless tobacco, which is commonly consumed in the Indian subcontinent. This smokeless tobacco comes in various forms like gutka, khaini and other things. So the so-called zarda, or mixed with pan and other nutmeg and other things, is the one which causes ulceration and later on cancer in the cheek. This cut is kept in the oral cavity, that is between the cheek and the teeth, in that sulcus or in that groove, and this being in contact with the cheek for quite some time throughout the day causes some changes, especially the nicotine content of the tobacco is the culprit, which causes changes in the architecture of the cheek, which we call the mucous membrane. Internal lining of the cheek is called mucous membrane. It starts like a small kind of whitish patch, what you call leukoplakia. Then it may also progress to a little reddish patches called erythematous patch, what we call medical language. Then later on there some changes occur which we call dysplasia, finally leading to anaplasia, otherwise called cancer. So it takes some time, nearly about 10 years, for the individual who is habituated and addicted to tobacco chewing to develop a fulminant cancer, or what is called frank ulcer or cancer, frank cancer, which requires treatment. So before the cancer develops, actually there are certain changes which occur in the mouth because of the tobacco effect, like what we call decreased opening of the mouth. The mouth opening becomes over a period of time gradually very limited. It cannot open the mouth fully as others can. This is what is called submucous fibrosis, otherwise called is a tethering of the innermost lining of the cheek and throat. This is called mucous membrane. It becomes little stiff. It's not elastic and easily mobile because of the contact or the frictional changes which occur between the tobacco cut and the cheek, that is innermost lining. So slowly this kind of stiffness develops into what we call dysplasia and cancer. So the earliest symptom or alarming sign for somebody who is habituated to tobacco is inability to open the mouth adequately. Secondly, the staining of the teeth. As you could all see, these teeth get stained because of the tobacco constant use. Then comes the problem of speaking very well. Because mouth opening is limited, the speech also gets affected. And these changes which occur throughout the mouth will progressively cause less and less opening. Ultimately, a situation would be there where he can hardly open the mouth. Still, he or she manages to somehow eat food and survive. The ulcer becomes so severe and so big that the cheek also feels swollen up. Externally also on the face you find the cheek is swollen up, and inside you find the ulcer, and with difficulty with a torchlight one can see it on the cheek extending into the teeth, that is gum region. So this is in short how the ulcer develops, which is called ulcer cancer or cheek cancer. So this is one established reason, cause of cancer. There are other reasons also for developing oral cancers, especially the spicy foods that we consume a lot. Secondly, the incongruent or non-aligned teeth. Teeth are not in proper alignment, so often leading to what you call tongue bite or cheek bite. There is always a rubbing, friction of the teeth, sharp edges of the tooth or teeth with a particular portion of the tongue and cheek, causing ulceration, and over a period of time, maybe 10 years or so, an ulcer may develop in the area of contact, sharp edges. So this is sometimes present as a dental ulcer or ulcer for which the patient seeks the opinion or consultation with the dental surgeon. So the dental surgeon, being aware of the features of cancer, can immediately take action to see that it is nipped in the bud or treatment is given at appropriate time, at the same time correcting the sharp edges of the teeth or malalignment. So cigarette smoking, tobacco chewing, sharp edges of the teeth, very spicy food, then consumption of alcohol in over and above the prescribed limit, in abundance, as kind of addiction. These are some of the causes, and in the olden days, sexually transmitted diseases like syphilis used to be blamed for oral cancers, also non-healing or chronic ulcers. So these are various situations where the ulcer develops, which later on turns out to be cancer. Apart from these tobacco and other features which we discussed, there is also nowadays what is called head and neck cancers. The role of the virus. HPV virus, human papilloma virus, is a virus which has got subsets or clones of nearly 36. Some of these cloned viruses, that is sect of viruses, cause not only in the oral cavity and head and neck regions, but also in the private organs like penis and vulva and vagina. These papilloma viruses spread from individual to individual because of the various contact processes. Generally, boys and girls also can be affected by the infection of the human papilloma, otherwise called HPV infections, virus infections. They start as warts or some kind of nodule or a bump, small bump, and later on progress on to cancer. That's why, as you might be aware, the vaccination also has come into use nearly 2 decades ago. That's called the vaccine is made out of these viruses attenuated, and there is weakened virus. These vaccines are given to boys and girls before the age of say 9 to 12 years and boys between the ages of 6 and 9 years. So human papilloma virus is constantly blamed for developing the cervical cancers in women and head and neck cancers in men. So these are some of the causes which cause oral cancers. Now, as I have enumerated, you have seen the magnitude of the problem, 65,000 cases a year. 6th cancer, commonest cancer in the world, and 2nd in men in India, and 3rd in women in India. Having seen the magnitude of the problem and knowing the reasons why this cancer develops, it's now anybody's guess what to be done to prevent it. In short, some of the habits like tobacco use should be curtailed, condemned, and stopped altogether to escape this tragic situation of oral cancers which mutilates 100% the individual. Imagine a situation where a guy cannot talk, cannot breathe well, cannot eat properly, the kind of quality of life he has. So prevention becomes paramount in these situations. And any ulcer which doesn't heal within 3 weeks should be consulted by a doctor to rule out any possibility of any cancer developing in the ulcer. So chronic non-healing ulcers, 3 weeks and over, not responding to any kind of treatment should be viewed cynically, and it should be suspected that it will be a cancer ulcer. Coming to other parts of the cancer ulcers, they are not very difficult to treat, like lip cancer, a complete cure can be achieved. So also palatal cancers if they are early. The hard palate cancer, as shown in the figure, you could see a guy is smoking the burnt end of the cigar inside the mouth, and that causes what we call the khagri cancer in Kashmiris, where they keep the warm or hot khagri containing the charcoal, hot charcoal, under their garments in contact with the skin to escape from the cold. This also causes a kind of frictional ailment or frictional ulceration between the abdominal skin and then the khagri, leading to cancer ulcers over the body. Similarly, the situation is here. A burnt end of the cigar being kept and smoked can lead to this kind of cancer, as shown in the figure. You have seen the other figure where guy has developed pretty young, hardly 32 years, a huge ulcer in the cheek on the left side, and is not able to even open the mouth properly. So the effect of these cancers is that these cancers cause a lot of discomfort, and the quality of life suffers 100% and becomes very difficult to treat at times when the skin over the cheek is also involved because of the burrowing of the ulcer cancer from the innermost part of the cheek, that is mucous membrane, onto the muscles that help us in mastication and onto the skin. So there are various stages in this, and as the stages advance, because the local spread, the treatment also becomes more extensive and the outcome also becomes a little bleak. Then comes what you call some nodes in the neck. These are the lymph nodes where they get involved because of the cancers in the throat. There are different stations of the lymph nodes which are placed in the neck. So station 1 to station 5, that's called level 1 to level 5 medical language. These lymph nodes also get studied with the lymphatic spread of the cancer, and the cancer cells migrate through the lymphatics into the lymph nodes. So cancer spreads from these ulcers in the mouth not only by bloodstream but also through the lymphatics. Like you have a septic focus on your finger, sometimes later you develop a kind of nodule palpable in the axilla that is called lymph node. Similarly, from the cheek and other parts on the same side affected, the lymph nodes also get enlarged because of the cancer. The cancer cells migrating into the lymph nodes, that becomes advanced stage. So the cancer which develops at a particular region in the mouth will not stay put there. It spreads externally onto the face and also into the neck. So these are some of the things which should be remembered while treating a case of cancer in the cheek or the tongue or floor of the mouth. So these areas called lymph nodes have to be addressed while treating the patient. Now, having known a bit about preventive aspects, what consists of treatment protocols for these cancers? Obviously, the space available is very less. In a cheek cancer, naturally you have to cut and remove the cancer area. And as a principle in surgical oncology, otherwise called cancer surgery, the doctor aims at arvo resection. That means the surgeon doesn't want to leave any residual disease, some disease in the treated area. Say cheek, we have to excise as liberally as possible. There are some standards for that. How many centimeters from the edge of the ulcer you have to go up, down, into the other side and all that. So depending on these principles of surgical resection, what we call the part of the cheek, part of the mandible, lower jaw, because we cannot get clearance. The ulcer is burrowing into the gums. That's why, and sometimes part of the facial skin also are surgically removed, and then the gap which is there is filled by plastic reconstruction. There are advanced methods of reconstruction, including taking tissue from the lower limb, that is bone, skin and muscle all put together with a blood vessel supply being intact. This is called free grafts or venous grafts. Then there are also age-old tested techniques of using various flaps from the chest wall to fill up these defects and close the skin over them. Fairly good results cosmetically, functionally can be achieved by these procedures, but the end point is that the functional ability like chewing and also the cosmetic aspects of surgery are limited. We cannot expect the natural contour and the natural free movements of the jaw in a reconstructed area. It might be near okay, but not 100%. So the dreadful thing is not only the mutilating operation, but also the outcome is not that perfect compared to natural normal mouth. So keeping this in view, it becomes all the more paramount that these ulcers should be diagnosed quite early. So the hard palate ulcers or cancers are one subtype where surgery plays a secondary role. Mostly it is treated by radiation and sometimes along with the weekly chemotherapy. So for oral cancers, mostly though surgery is the treatment of choice by removing the affected area along with surrounding tissue and reconstruction, but also in other areas like hard palate, radiation plays a vital role, and there is only line of treatment in hard palate and sometimes areas behind the tongue, that is we call posterior third of the tongue. So some situations demand that to preserve the organ and function, surgery is avoided, and by alternate methods we treat them, which is the radiation, which comes in different forms. Most sophisticated radiation gadgets are available nowadays like IMRT, IGRT and rapid arc, which treat these cancers very well with a curative rate as high as about 70%, depending on of course the situation and the extent of the disease. Sometimes after surgery on the cheek cancers and oral cancers, we also give radiotherapy post-operatively because the local recurrence rates may be high in a locally advanced case treated only by surgery. So it becomes very difficult to treat these cases with the intention of giving 100% cure rates and good cosmetic value and also functional ability. That's why the earlier the diagnosis is made, the better are the outcomes with the modalities of treatment that are available around the globe as of now. So some of the pictures which we have uploaded will not to scare you but alarm you that this kind of mutilating tumors should be a kind of curse. That's what we should feel is a curse. That's why to avoid this curse, the best way is to try to prevent it. And at the end of the day, I would like to say that oral cancers is a very challenging problem for all the three modalities of treatment experts, especially surgeons like me who will have to do called composite resections, complicated surgeries with reconstruction, and also the limited space available in the oral cavity and back of the tongue prevents to do any radical surgeries, and the quality of life has to be preserved by these surgeries. That's why limited surgery is one option here where we can preserve the organ and function.